Okay? On the female, kind of lined up like this. Okay? Again, we take this off and we see the pubic symphysis. Okay? Now, again, we can follow ureters. Here I have a ureter. Let me double check. Yes, I have a ureter coming down here. It's labeled with a number 9. Okay? Coming down here, I see the bladder, and it has a tube going into it. That's the other ureter going to the bladder. Okay? And when we look at females, we have a urethra, bladder, a vagina, and a rectum lined up from anterior to posterior. Okay? So we have the urinary bladder. We have a urethra leaving the bladder. Behind the urethra, we have the vagina. Behind that, we have the rectum. Okay? When we take a look at the vagina, up near the top, we have a cervix. We have lips that protect it, the labia minora, the labia majora. We have a clitoris or clitoris. We have a, I don't know what that is.
Broad ligament.
I'm looking at rectus on mine. I'm going, there's no rectus. I think it's supposed to be rectum. It is rectum. Misspelled. I was kind of going, what? I thought I already covered rectum. So we have the rectum here. Okay? So again, we have urethra, vagina, rectum. Okay? Straighten out rectus. Okay? All right. Now, when we look at broad ligaments, there's a nice big white area here, which is called the broad ligament. The broad ligament is supporting, we're looking at something like this. This is bladder, uterus, rectum. The broad ligament is this thin line here that supports the whole uterus. Okay? When we take a look at the inside of the uterus, we have endometrium, which is this red lining on the inside. The myometrium is the muscular layer on the outside. There is a parametrium. Somehow it didn't get on my notes. Oh, it's across the way on the other model, parametrium. Okay? When we take a look at the tubes coming into this, a little bit kind of complex here. When we take a look at this, we actually have, let me make sure we have all these down here. There's a tube going into the uterus that has a hole in it. That's the fallopian tube or the oviduct. The other two things are ligaments that help support the uterus. The middle one is an oviduct. So we have a tube going into the bladder, which is a ureter. We have a tube going into the uterus, which is a fallopian tube. Okay? Now, we have another round thing that comes directly from the ovary, and that's the ovarian ligament. So I'm looking at this model here. See the ovary up here? There's an ovary there. There's something that's connected directly to it. That is the ovarian ligament. The fallopian tube is this funnel-shaped thing that doesn't quite touch the ovary. Okay, it's got the fimbriae or finger-like projections. That's the oviduct. What's connected directly to the ovary is the ovarian ligament. So on this model here, this is the ovarian ligament posterior. Then I have the oviduct, okay, or fallopian tube. Here I'm showing the fallopian tube here. Now the infundibulum is the expansion of the fallopian tube. And fimbriae are like these fingers that go around the ovary. So I have fimbriae, infundibulum, and then I have oviduct. It's right in the middle of these three tubes. Okay? I'm looking for round ligament, and it doesn't. These all got ligament round. This is your round ligament, the anterior one. Okay? So when I'm looking at this stuff here, I had ureter. I had round ligament, I had oviduct or fallopian tube, and then I have ovarian ligament posterior. The thin line of all of this is the broad ligament. When I take a look at the inside, I have myometrium and endometrium. Cervix, vagina, I have clitoris, labia minora, labia majora is not on here, and I have rectum on the back. Round ligament. The suspensory ligament, I'm just going to use broad ligament on this. So I'm not going to do suspensory ligament. It doesn't show on this model. Infundibulum, these truncated weird. I was supposed to have ovarian ligament, comma, suspensory ligament, comma, round ligament, comma. Okay? So on this, we did pubic symphysis, ureter, urinary bladder, urethra, we did vagina, we did cervix, labium majora, labium minora, clitoris, rectum, broad ligament, uterus, endometrium, myometrium. You might as well add right across the way is parametrium. You should be able, that's the outside. We did oviduct, fallopian tube, or uterine tube. We did, I hope I did ovary. There's only one ovary on there, and it's right there. Okay, chestnut-sized thing there. That's the ovary. The fimbriae are the finger-like projections that go right against it. The funnel-like shape of that oviduct is the infundibulum. Then I have ovarian ligament connected to the ovary. And I have round ligament, which is on the anterior side. So there's round ligament is right there, and ovarian ligament is right there. When I look at this side, I have ureter, round ligament, oviduct, ovarian ligament. The broad ligament being all of this sheet-like, okay, which connects with the suspensory ligament. It just doesn't show it on here. This tube is the vagina, this is the bladder, this is the rectum. All right, on this, gosh, let me get another, just get a little bigger one if I have it. Okay, on this we have the umbilical cord. On the umbilical cord, if you look at this closely, it has two umbilical arteries and one umbilical vein. It has one red thing coming back from the placenta, two blue things which are the umbilical arteries. Okay? Excuse? Yes. No, let me think about this a minute. Yes. The umbilical artery is blue and the umbilical veins are blue. I think I just got the colors reversed. The amnion is this membrane.
You said blue and blue.
I have red and blue. Okay, the blood coming from the fetus is blue, and that is the umbilical arteries. Returning from the placenta is the umbilical vein, which is red. Okay? So the reverse color, okay, because the only place this gets oxygen is from the artery, the placenta. The amnion is this membrane here. The placenta is this dark thing here. There's an ovary right there. Okay. There is an oviduct, which is the pink tube. Okay. We have fimbriae, infundibulum, and the oviaduct or fallopian tube. This coming from the ovary is the ovarian ligament. Okay. This white thing coming from the ovarian is the ovarian ligament. This is the fallopian tube. On the uterus, we have the endometrium, which is in pink. We have the myometrium, which is the muscular layer, and this outer layer here would be the parametrium. Okay. We also show the vagina. This is the cervix. This is the vagina. Okay. When we take a look at this really would be the round ligament, the ovarian ligament. This doesn't really show the broad ligament, a little bit of it right here.
Which is a round ligament?
This is your round ligament, okay? Then the fallopian tube, and then the ovarian ligament going here, okay? So it doesn't show it real well, but this is the ovarian ligament, the fallopian tube, and then the round ligament here. Okay, it shows better up on this model here where you have, you know, however I put this, you have to find an anterior portion of this. Okay, so I put this down like that. You got to start thinking where's the front and the back. Okay, so here, rectum in the back, bladder in the front. So that makes this here the round ligament, makes this one the ovarian ligament. This is the ureter. Okay, so you have a clitoris on this, a labia minora, rectum, vagina, bladder, ureter going into the bladder, round ligament anteriorly, fallopian tube that's has a hole in it, and then ovarian ligament posteriorly, the broad ligament being this white line. Parametrium, pubic bone.